New rules to allow home quarantine in local cases. The Central Epidemic Command Center (CECC) yesterday released new guidelines that allow people with mild cases of COVID-19 to quarantine at home. The announcement came after the CECC on Saturday last week said that more than 99% of local cases reported this year had mild or no symptoms. Premier Su on Sunday announced the new Taiwan mode for fighting COVID-19. The government should strike a balance between disease prevention and economic growth, Su said. Philip Lowe, deputy head of the CECC's Medical Response Division, yesterday told the center's daily news conference that people with COVID-19 can quarantine at home if they have mild or no symptoms, or younger than 65, or not pregnant and do not need to undergo dialysis. Members of a household in which a person is quarantining must also meet the criteria, he added. The quarantined person must stay in a separate room, while shared showers and toilets must be cleaned thoroughly after each use, he said. The rules apply to all people listed as domestic cases, including those who tested positive after completing mandatory quarantine after arriving in Taiwan from abroad, he said. Those listed as imported cases can quarantine at home if they live alone or quarantine together with another infected person in the same household. Lowe said, adding that exceptions might be made for people with special care needs. People living in the same household as a person quarantining at home should be tested 3 times, 10 days after the case's initial diagnosis, as well as 5 and 10 days after the person began quarantining at home, he said. People who live in a household with 4 or more others would not be allowed to quarantine at home, Lowe said. Cases can leave home quarantine if they test negative in a home test or a polymerase chain reaction test, he said. People who test positive 10 or more days after their initial diagnosis may also leave home quarantine if their cycle threshold value is 30 or higher. They have not had a fever for 24 hours and their other symptoms are easing, Lowe added. Upon ending home quarantine, the infected person and anyone living with them must practice self-health management for 7 days, with mandatory self-administered rapid tests on the 3rd day and 7th day, he said.